before we invite our first speaker, Nelly Vasily, we'd just like to get a sense of what you are observing in your own communities. So Nelly is going to be speaking to us today about how women and young women and girls are being impacted by the COVID-19 pandemic, and also how communities and governments are responding. In our registration with you, we asked you the following question. What are you observing? So this is some of what you shared with us. So a number of you noted that you're observing or anticipating that access to services for people with disabilities is going to decrease, also increase isolation, and a couple of people talked about the impact it's having on caregivers. All right, great. So a lot of you indicating here that about increased isolation. Thank you for sharing that. These are really issues which Nelly is going to speak to and expand on as she talks to us about these questions you can see here. Thanks. How girls and young women with disabilities being impacted and affected by COVID-19? Welcome, Nelly. I'm really excited to hear your perspective. Thanks for joining us.
Thank you so much for having me. So yes, hi, Nelly here, coming to you from Tiohtià:ke, which is so-called Montreal, on the unceded territories of the Kanien'kehá:ka Nation, who are custodians of these lands and waters. And I want to shout out for those who are in Tiohtià:ke, so-called Montreal, if you can help out with the efforts that are being done to help Indigenous and homeless populations, check out Resilience Montreal. Now, to jump into the subject directly, the reality is girls and young women with disabilities are often neglected, ignored, forgotten, and invisibilized in everyday non-pandemic conditions. The COVID-19 pandemic doesn't change any of that. What COVID-19 has done is put a huge spotlight on all the inequalities and failings of our systems that make them more vulnerable. Girls, women, non-binary, and gender non-conforming persons with disabilities, what they and those around them have been advocating and asking for years and years is social protections without discrimination. And what that means concretely is adequate, inclusive, emancipatory, safe, healthy, culturally sensitive access to things like food, shelter, education, health services, including sexual and reproductive rights services, good, stable, secure sources of income and transportation, to only name a few. But all of this is not new. More specifically, those in disability communities who are living at the intersections of many systems of oppression. So that means girls and young women with disabilities who, on top of having to deal with ableism, also have to deal with racism, colonialism, sexism, queerphobia, transphobia, have been advocating not just for the right to merely exist, but instead, as disability justice activist Patty Byrne puts it, exist as whole complex beings. Further, girls, young women with disabilities, and gender nonconforming persons with disabilities who are institutionalized or rely on institutions to provide at-home care support services are at even greater risk. As COVID-19 pandemic evolves and as personal support care workers and nurses are devalued and underpaid in the medical field, girls and young women with disabilities who rely on institutions are even more disproportionately at risk of contracting the virus themselves in this moment, or of facing further systemic violence, be it because they fight for basic rights and needs to be met, or because they face interpersonal and familial violence at home. We know that sheltering at home is not the safest thing for everyone, and because they have to face financial violence due to poverty brought on by significant barriers to accessing proper education and formal employment, or because of an over-reliance on informal sectors of work and care. All of this puts them at risk, and on top of all of this, due to disability-related needs, girls and young women with disabilities have higher costs of living than those that live without disabilities, and that's because there are costly and unequal access to medication, therapy, assistive devices, and various technologies. So girls and young women with disabilities may struggle in accessing also in this moment education because they may be further deprioritized And accessibility barriers with virtual classrooms, for example, may be higher due to unequal and inadequate access to things like internet, to computers, but also with educators and families who may not have the right tools to adapt teachings for an online environment, or may simply not see the value in educating those most marginalized because of internalized ableism and biases. Now, governments should be ideally responding with rent freezes, basic income boosts, food subsidies, proper access to education, free clean water and hygiene measures, including menstrual hygiene for girls and young women with disabilities to ensure they live in dignity. But what's really been happening is that communities, so folks with disabilities supporting each other and families and friends stepping in with care work, are coming together to fill the gaps as best they can. And concretely what that looks like is mutual aid groups that can be citywide and organized virtually over social networks, or just small pods of 2 to 20 people who are working to support one another, popping up in hyper-local ways. What that also has looked like is caremongering schemes. So a big shout out to the Disability Justice Network of Ontario for prioritizing racialized and disabled folks by creating a centralized system with phones and request forms and distributing flyers translated into Arabic and French and English and Spanish and dropping them in at-risk buildings. The DJNO estimates that they've been able to feed 500 families with the help of 200 volunteers. And basically these schemes are led mainly by Black, Indigenous, and other disabled folks of color who self-organize to receive food, water, and hygiene supplies, or monetary donations, as well as volunteers to sanitize, pack, and deliver basic necessities to disabled, sick, and otherwise vulnerable community members. And in many ways, the failings of our capitalist system are being and have been patchworked by disability justice activists who, for their survival, have really have already been thinking about how to live collectively and interdependently. And I know I'm going a little over time, but I just want to also emphasize that when it comes to health services, sexual and reproductive rights really should not, I should say, be deprioritized by governments in times of crisis. But the reality is that even not in times of crisis, comprehensive sexuality education for girls and young women with disabilities has long been deprioritized. And I want to point out that we talk about these exact issues, among other things, in a new Dawn research report called Girls Without Barriers, an intersectional feminist analysis of girls and young women with disabilities in Canada, and this is coming out in May 2020. And while we haven't been through the scale of this COVID-19 pandemic before, what we know is that in times of crisis, health resources are diverted from routine health services, and the ones who will really be less prioritized in this moment are girls and young women with disabilities. I'll stop there for now. Thank you.
Thank you so much, Nellie, for giving us that really excellent overview. I'm just reflecting on some of your comments and some of the conversations we've had in other installations of this series. And really, you talk about caremongering and how communities are coming together to fill the gaps where governments have in many ways failed. And thanks for providing those really specific examples, which I was seeing from Ontario and other parts of the country. Also, you mentioned the importance of really making sure that routine health care, particularly sexual and reproductive health, stays in place. And we heard this again about what is not happening as resources are being diverted to the COVID response. Like, how do we keep other systems of support in place? So thank you so much for those, and we'll be coming back to you again later when we go into our discussion with the two other speakers.